Hi there. If we haven't met yet, my name is Natalie, and I'm an integrative health practitioner. And I just want to take 10 to 15 minutes to go over my program and how I can help you. So, I help women lose weight, rebalance their gut, and transform their life through integrative health practices. And I want to highlight where you may be at this time and what are the possible outcomes when you go through this program. So, right now, you may feel overwhelmed. There's a lot of conflicting information out there. Maybe you've gone through a lot of different diets and supplements and gotten little to no results. You may be dealing with low energy, finding it hard to get out of bed, and drinking a lot of coffee, energy drinks just to get through the day. You may also be dealing with digestive issues like bloating, gas, stomach pains, constipation, and having difficulty losing weight. You may also be dealing with mood swings and not knowing what is the cause of that. And you may feel uncomfortable in your body. So, finding it hard to feel comfortable in wearing things. So for me, for example, I used to have a hard time finding like a bathing suit, or it was really stressful to go to events because I just couldn't find anything that I felt comfortable in. So, my mission is to give you a roadmap so that you can feel empowered and energized and feel confident in your body again. And I do this through giving you a roadmap so you know exactly how to nourish your body. And this is a little bit of my story. So, this is why I started practicing integrative health. So, as a kid, I suffered from constipation, from stomach pains. I would break out randomly in hives, and nobody ever taught me, no doctor ever did a root cause analysis and taught me how can I prevent this further. And I saw a lot of my family members battle with diabetes, heart disease, arthritis, and some of them developed cancer later on. And I thought this was just genetic and we had no control over it. And what sparked my interest and really my journey into preventative health, it was my dad. He was able to reverse type 2 diabetes with changing his lifestyle and eating, a certain way. And this is really how I just went so deep into integrative health. I got my certification. I learned about functional labs testing, which is actually something I'm going to share with you in a minute. And this is how I was able to know the root cause of my negative symptoms. So this is me on the left over here. And I used to wear dark dresses, long dresses. It's actually in Puerto Rico. So it was super hot weather. And I still, because of my bloating and I didn't feel comfortable in this weight, I didn't feel confident to take pictures. There's not a lot of pictures of me at that weight. And on the right, I actually achieved my ideal weight. I was able to wear crop tops again, bathing suits. I was taking pictures of myself and just sharing myself more. But I was still dealing with stomach pains that would just randomly happen and low energy and also just bloating randomly as well. And I will go over this labs more in depth, but these are some of my results. And these are functional medicine labs. So the first one up here is a urine lab, and I use this in my practice later on. So I will go into this. But for now, the organic acids test is a urine-based test, really easy to take, and it shows the yeast and bacterial overgrowth that you may have or your vitamin metabolites. And on the bottom, we have the minerals and metals test. This is a hair tissue and mineral analysis test, and it shows you any mineral imbalances that you may have that may be interfering with your body's like digestion or maybe your energy levels, because it also tells you any heavy metals that you may have that are most likely the root cause of a lot of your symptoms. And I just want to highlight the difference between conventional and functional medicine labs. So, in conventional medicine, they usually do blood tests, and your blood test is actually regulated to keep things in balance, right? So, when something shows up there, it's already a bigger issue. For example, you may show good levels of calcium in your blood. We don't know if that's actually extracting your body's extracting that calcium from your bones to keep that blood in balance. So when it actually shows up in your blood, then you are already experiencing bone loss. And in functional lab testing, we actually go deeper. So we use hair, stool, urine, saliva to see how your body is actually using those minerals and much more. So in conventional medicine, it's more disease oriented, right? And it asks like, what pill can we give you in order to solve this issue? As opposed to functional medicine, we really can take proactive measures. So even if nothing shows up as quote unquote wrong or negative, we can take these proactive measures and catch things before they get worse. And we can optimize your body as well so you can prevent further disease later on. In conventional medicine, it's usually a one size fits all, but in functional labs is unique and customized to the results, whatever what's actually happening in your body. And conventional usually asks what medication can help suppress the symptoms. As opposed to functional medicine, we ask why is this happening and how can we address the root cause in order for the symptoms to go away. So these are the two labs that I use in my practice and in this program. So the first one is the minerals and metals test. It uncovers like what's driving your fatigue, your low mood, brain fog, and poor sleep. It can tell us your mineral ratios, like your zinc and magnesium, and any heavy metal toxicities that you may have. This impacts your digestion, your adrenal. So all these things, for example, can slow down digestion and be a driving force with your bloating and stress levels. And then on the right, we have the organic acids test. And this one can tell us bacterial imbalances. How do your body, if you have any vitamin deficiencies, any yeast and fungal overgrowth, and that uncovers what's driving your bloating, your gas, your low energy, and your mood swings. And I want to highlight the old way and the new way. So, in the old way is what we've all gone through. You can probably relate to this. You've gone to the doctor and gotten your labs as normal, but you still feel horrible. And you're probably like, what else can I do? And you're feeling exhausted, losing hope. You're wasting time going to these recurrent appointments and money, right? And you're also going through fad diets that do not have sustainable results and using supplements again that you don't know if they're actually top notch in functional medicine that your body actually is deficient in or that needs that it has the correct clinical dosage. And you're trying everything on your own. You're doing this all by yourself, as opposed to the new way, which is the future of medicine. We use functional medicine labs and we get to the root cause. You have one on one support. We have a personalized roadmap according to your lab results. And we build long term sustainable habits. You also have accountability and education so that you understand what's happening and why. And this is how I can help within this program. So you'll get a personalized protocol. You'll also get my guidance and liver detoxification protocols as a key foundation. You'll get meals and exercise guidance as well. And we'll go over your lab results so that we can identify potential root causes of your symptoms. We also build sustainable lifestyle and wellness habits so that you can carry for the rest of your life and you can share this with your loved ones. And the step one is pretty much just book in a call with me. Then you'll receive actionable steps to get started right away. And you'll meet with me once every 2 weeks, so bi-weekly, and you'll also have daily messenger support. And after that, you just have to trust the process and watch your health and your life transform. And just to put this into perspective, it is estimated that the average American spends on healthcare 12,000 to 14,000 a year. And this is mainly in recurrent appointments, in medications that are only band-aid solutions, right? It is costing you the time. You're having to take out time from work and different events just to make this appointment. Sometimes you have to make it months in advance in order to get like the actual time with a doctor, right, which can last anywhere from maybe like 15 minutes sometimes, and not having that ongoing support. And this is all costing you emotional distress. It's causing that emotional distress as well. And as opposed to working with a one-on-one with an IHP is actually less than 5,000 for 3 to 6 months. And you'll have one-on-one support, customized protocols, and at-home lab testing. And you'll get the answers that you need and education that you can use for yourself, again, for the rest of your life. And this is what you get in this program. If you were to get this a la carte, this is just an estimation of what it could go up to. It could be more, it could be less. So for custom nutrition protocol that needs constant adjustment and again, going through these protocols that I'm going to help you go through, this could go up to $2,500. And for supplement recommendations and protocols that I include, again, top-notch functional medicine, this could go up to $1,200 and or more actually. And for personalized exercise guidance, if you were to be with a personal trainer and getting constant adjustments, again, This could go up to $600 depending on who you work with. And the lab test that I included is an $800 value. You get the results, you get all the data, and we'll go over with you so you can learn what's actually happening. And if you were to get everything that I have in my head right now, everything I'm going to share with you, that education that I went through, that will be a $5,000 value. You also get one-on-one bi-weekly calls with me and daily messenger support. So you can literally text me anytime. This is literally what I do, so it doesn't bother me at all. I actually want you to text me all the time, and I'll walk you and I'll be there with you every step of the way. So the total value for this is $10,100, but I only charge a fraction of this. And I only take 3 to 5 clients per month. And I could take a lot more, but it's really important to me that every client that I work with feels supported and that we get them the results that they want. So this is why I only take 3 to 5. And again, if you want to work with me, just book a call and we're going to go over your goals and the strategy to help you feel better. So again, thank you so much for your time. I really value your time. So thank you for being here. And I hope that we speak soon.